Greetings and welcome to the Elephant TV. My name is Joe Kobuthi. Today I'll be speaking to Dannish Odongo. Mr. Odongo is a mental health advocate, he's a writer, he's an activist, he's a speaker, communicator, former journalist, and many more things under his purview. Karibu Dannish to the Elephant.
Asante sana. You can never be a former journalist.
You can never
So you can never be a former doctor or a former teacher.
Thanks for that correction.
Yeah.
Dannish, let's just start this conversation. So a couple of years ago, you wrote an article for The Elephant, and brilliant article, writing about your experience, one, in the newsroom, and then your experience out of the newsroom doing civic work and society work, engaging as a advocate for many issues. But the underlying theme in your piece was this idea of mental health. And you were talking about your own experience, undergoing mental health issues. And just not just with you. In the last couple of years, we've seen an increase of mental health awareness. Of course, data has also lent a lens towards this issue. What's going on, Dannish, in the public sphere that we're going crazy?
Thank you so much, Joe. Yeah. So it's really a great question, but we are struggling whether now that there's a lot of access to media, especially social media, that's why now we are seeing more of these stories. Perhaps were they just there before, but now we are seeing more reporting happening. For example, in 2019, they reported that about 480 people had died by suicide. But if you look at that data, how we collect data on suicide is terrible because we cannot prove motive. So we can only say somebody died by suicide when they died by hanging, or the self-harm and all these things. But somebody who drowns by suicide, somebody who drives behind a lorry and dies by suicide, somebody who walks into the path of a road and dies by suicide, that person will not be considered as death by suicide because we don't have enough expertise to know the motive. And therefore, so there are two things that whatever we are seeing is just a tip of the iceberg, because then there's a lot of social media and a lot of conversations, and celebrities are coming out to talk about mental health, mostly illnesses and issues. But what we are seeing is just a small tip of the iceberg. The real issue is people who may not be mentally healthy, but they've not reached a tipping point. It's sort of like when you're an alcoholic, but you're a functional alcoholic. And so we don't see that as a problem. We only want to rehabilitate those who perhaps have tipped over out of spending, gambling, and making risky behavior. So in this country, there's a bubbling under thing of people with severe mental health challenges, which are not categorized in the illness category like schizophrenia, bipolar, and all this sort of stuff. But they're dealing with a lot of trauma that then affects how they see the world around them and how they operate. That's the real issue for me.
Wow. So what you're basically saying is that we're all crazy, just we have not shown our particular kind of madness yet, right? But just moving the conversation, Dannish, you've also been talking about the link between mental health and governance.
Yes.
I'd like you to also give me the history, because for most people, when you talk about mental health and governance, we're talking about economic policy, right? So we talk about GDP, microeconomics, at least for how governance has been wired for the last, say, 30 years, right?
Yeah.
Or we talk about political reform in the sense of constitutionalism, building institutions, the rule of law, etc. Why the link between mental health and governance?
There's a concept called ACEs, Adverse Childhood Experiences. These are about experiences that if you go through before you're the age of 13, then they're likely to adversely affect every indicator of your life, whether it's employability, impulsivity, health, including cardiovascular diseases, and all these things. And a lot of evidence has been generated, mostly in the US, that there's a correlation between families that come from marginalized communities like the blacks and whatever are 4 times more likely to be diagnosed with ACEs that then affects all their life, all through their life, So that's in the US. But now let's come back to Kenya. If we talk about SS, one of the SS is abandonment, is gender-based violence, it's hunger, it's the lack of security. So when we look at Kenya as a country, we are seeing it as a potential hotspot for SS all across the country. But we have done a lot of work to focus on the macro issues, but we're forgetting that this kid who's growing up in an abusive home, and this home is, the father perhaps is abusive for many reasons, but one of them could be frustrations with lack of job opportunities, which then leads them to drugs and substance abuse and many of these things, you know. And then you're not looking at the fact that we're just 2 generations away from an entire colonial experience that completely, you know, ruined how we interact with ourselves and with our communities, you know. So I can tell you, in my opinion, it is not scientific, but based on what I've understood with SS, a majority of Kenyans, if we're to do today a national survey, I can say that at least 6 out of 10 have gone through SS. And that's why when we talk about governance and mental health is a governance issue. Because when systems are broken, safety nets, when homes are broken, when schools are broken, when society is broken, the place that it breaks first is your mind. And so we need to talk about mental health not as a disease only. The disease model and component of it is very small. Only 10% of the population will tip over and get into the disease spectrum of it, of bipolar, schizophrenia, ADHD, depression, all these things. A majority of us will not tip over, but we will make bad decisions. And that's why, for me, I see this as a governance issue. Yeah.
So then how do we take the, I mean, well put, but how do we take the conversation forward in an environment, one, that, I mean, as you rightly say, we're 2 generations away from colonialism, so we're still addressing colonial hang-ups, but in a space where our governance infrastructure is one, into my mind at least, it feels static. It's stuck towards a particular paradigm. How then what do we need to now create a new paradigm? Because what you're talking about is actually a new paradigm of looking towards the governance conversation. How do we take that leap?
People change when there's pain, and that pain, when the pain of staying put is more expensive than the pain of changing. People change when the reward of change is bigger than the status quo. Unless we bring together experts who will do a correlation between these things, about especially the amount of money we are losing. Joe, do you know that Kenya spent 64 billion, according to Gender Equality Commission, in dealing with sexual gender-based violence, in terms of litigation costs and stuff like that? A huge chunk of that money could go into doing mental health services. And you will see proper reduction in sexual gender-based violence. Second thing, you know how much money we lose in terms of even the employment world to something we call presentism. So we talk a lot about absenteeism as the sign of bad mental health, that you're not coming to work. But presentism is where you're staying at work, but 60% of your time you're not being productive. We're not seeing that because you're zoning off, you're worried about your child at home, you don't know how you're going to go back home, and you're constantly in a state of flight or fight, which is bad for your nervous system, and therefore that affects your productivity, you know. So the paradigm shift I see happening, and I'm sorry to be a pessimist, is when you're going to see an explosion of mental health challenges. We're going to see a lot of bizarre things happening in this country. I don't want to be a prophet of doom because I'm a Christian. I like to be positive, but positivity alone will not cut it. We're going to see more shootouts happening. We're going to see a lot of armed police sort of like violence, by the way. We're going to see a lot of students being humiliated, like what happened in Kisii and all this sort of stuff. We're going to see a lot of violence that will be coming as a result of people not being able to cope with this. And perhaps then we will begin to go back to the public health model of looking at health from community, personal, and systems. Yeah.
So because we, I think the reason why we have conversations in the media is to amplify conversations before we get to that space. Rightly know, 8 million Kenyans didn't vote in the last elections. The Nigerian elections, 219 million population, are talking about something 3 million to 6 million people who are voting. So there's this sense of despondency, political despondency, especially among the youth, not just in Kenya, but I mean, we're seeing it now across other regions. It's playing out because now in political processes, that now we're able to now see that actually there's almost a resignation. In your view, Dannish, how do you link this kind of alienation that has led to a sense of checking out from the civic space amongst the younger generations and the growing mental health among young populations, not just in Kenya but across Africa?
That's an interesting way to look at it. But let me tell you why we're going to see the rise of young people not voting across Africa, because we see electoral process as legal processes. We're not seeing them as psychological. We're not seeing them as from an anthropological lens. We need social scientists to run voting, not lawyers, because then I respect lawyers and I think they're doing a fantastic job, but people will not just follow the law. People will not just go out and vote. We want behavioral scientists to tell us why this category are not voting. We want sociologists and psychologists and anthropologists, and I want to call them all out to participate heavily in the running of this country, because they know the problem. But they've been pushed on the periphery by people who are loud from careers that are important. We deem them as important, but they're not answering the existential questions that young people are asking today. Why am I here? If I vote, what will come out? Will this change my life considerably? And therefore, I think that the biggest challenge is that many of our young people in this country have had their psyche attacked by the media. They've been attacked considerably by them going to vote, and sometimes their voting does not result to their lives changing. Some of them feel like the young people they believe in, that they voted for, that the system has been rigged against them. And they're saying, why should I get involved if it won't change my life? So it's only in a way of building the psyche of these young people that we can see an improvement in them coming out to exercise their civic duties and come out and be very political in a way that then can change their lives. But this re-engineering will not be done by lawyers and politicians. It will be done by social scientists.
Finally, Dannish, before I let you go, we're in a kind of state, at least to my mind, where there's almost stuck as a nation, right? I mean, there's a sense of there's nothing to move forward to, yet there's nothing to move back to. And a good part of the conversation that we need to have is, as you've been having in different spaces around mental health and pushing these conversations, what kind of advocacy, communication how would that look like?
It must be radical and different. Yesterday I spent a dinner with Senator Oroba, and she was saying that we have made advocacy, especially from the NGO world, we've made a mockery of advocacy. So we are doing the same old things, but right now there are many ways you can do advocacy. One, it must be led by young people. Those young people on TikTok, there's a video of a young girl who was being touched in a matatu, and she recorded that video and went viral. We saw what happened after that. There's a considerable change. We saw what Senator Oroba did in Parliament the other day. It sparked a conversation. Now we're talking about period shame. And many of such things. We've got to think and act differently and do advocacy that is different from what we are used to. Because now we've reached a level where the shock levels of this country have completely been reduced. Nothing shocks us anymore. So we're not going to, protests are good and they're nice and all this sort of stuff. We need to do that. Secondly, bro, we've got to use data. Just I told you, I spent about 2 weeks ago, I spent time with the University of Michigan, where they're taking data that has been collected by Cambridge Wellcome Trust for a period of 13 years to look at how these kids they've been following for all that time, how they can improve their lives through this data that they've picked and how they can replicate that part of the country. So what can we do as the NGO world? We need to collect data. We need to do data-driven advocacy, where we go to these politicians and we say that as Inuka or as the Wellness Tribe, we've been following this category of people for the last 10 years. And we've collected this sort of data, which is scientific, there's ethical review board approved, and it's peer-reviewed and it's thorough. Then that is how we'll move the envelope and do advocacy that then will lead to policy change and will help restart this country, the heart of this country, which is slowly beating pole. And if we don't resuscitate this baby, there's going to be a challenge for all of us.
Dannish, on that very low note, thank you so much for your time here.
Thank you so much, Joe. Thank you for having me.
Asante sana.
Asante sana.